Hello friends, I am Dr. Rahul Gupta. I am Director and Head of Brain and Spine Surgery at Fortis Hospital Noida and Fortis Escorts Okhla. We deal with all type of patients who require surgery for brain and spine diseases. When we talk about brain, we can categorize these diseases into various categories like the congenital malformations, like the patient presenting with hydrocephalus, encephalocele, and other congenital lesions. Patients suffering from brain tumors. Brain tumors can be simple brain tumors in the parenchyma or on the surface like meningioma or glioma. They can be cancers like glioblastoma or metastasis. They can be skull-based tumors like pituitary tumors. In skull-based tumors, we go through the nose and with the help of endoscope, we remove these tumors without opening the brain. For brain tumors in the skull, we use special gadgets like operating microscope, which is a very good quality microscope which we are having at our center. Then we have neuro navigation. We take the CT scan or MRI of the patient, put it in our computer system, and then through the computer guided surgery, we remove the tumor. Sometimes for malignant tumors, we use tumor fluorescence. So tumor fluorescence is a special technique in which we give the medicine intravenously just at the time of anatomy, and then during surgery with the special filter in the microscope, we can separate the tumor with the normal brain and safely remove the tumor and completely remove the tumor. So all these gadgets which we have, they help us in improving the quality of surgery and better outcome of the patient. This significantly reduces the morbidity and mortality of the patient. Apart from that, we have got neurocath lab where we can do the PSA or angiography for skull-based tumors, and if there are very vascular tumors, we can pre-operatively embolize them so that during surgery the blood loss is minimized and we can go ahead with a safe surgery. In neurocath lab, we do the PSA and other endovascular procedures where we take care of the vascular malformation of the brain, like brain aneurysms, AV malformation, dural AV fistula, even carotid stenting for stroke patients can be done in neurocath lab. Then we do surgery for brain hemorrhage, like if there is an aneurysm which has ruptured or which has not ruptured, we can take up the patient in the operation theatre and apply clips so as to prevent it from getting ruptured, or if there is a mass effect or pressure effect, that can get reduced. We can also excise the ABM, we can close the dural AV fistula, we can open the carotid artery and do a carotid endarterectomy. So these are the vascular procedures which we are routinely doing in our operation theatre, and we have got all the gadgets needed for that, like good operating microscope, vascular angiography intraoperatively, a Doppler system, and neuromonitoring done by our anesthetist. We have got a specialized new anesthesia team who take care of the patients in the operation theatre as well as take care of them in the neurosurgical ICU if required. So results over the years have improved gradually with all these gadgets, techniques, and our technology which we adopt. We are always pro to the new technologies and new procedures. We keep on doing them. Other procedures which we do are for traumatic brain injury than for spine. For spine, we do procedures for congenital malformations. We do surgery for degenerative diseases like disc bulges, lumbar or cervical canal stenosis, and we do for mild scoliosis, and we do surgeries for any spine tumor. Spine tumor can be within the bone, can be within the spinal cord, can be outside the spinal cord but compressing the spinal cord. So all these surgeries are done with good success rate at our hospital using all those gadgets, and it's a teamwork. It is not just I who is operating. I have got a team of neurosurgeons, our assistant neurosurgeons, technicians, specialized neuro staff nurses, neuro anesthesia team, and sometimes we take help of neuro physicians, plastic surgeons, orthopedic surgeons, cardiac surgeons along with us so that we can make the surgery maximally safe. So all these people are available in the hospital who jointly work with us to reach a goal, that is to cure the patient of his disease. We have got the radiotherapy and chemotherapy department as well, where the patients with malignant brain or spine tumors can be treated after the surgery has been done successfully, and these patients are then cured by these other modalities of treatment. So we do also surgery for facial pain, for pain in the body, for the spasticity of the lower limbs, like implantation of the baclofen pump, implantation of morphine pump. For movement disorders, we are doing surgery by placing an implant in the brain, which is known as the deep brain stimulation or DBS surgery. We can do vagus nerve stimulation surgery for patients who are suffering from intractable seizures. So surgery for seizures, or for the epilepsy can also be done in our hospital safely. We have got a good backup of neuro anesthetists as well as neurophysician. We have got neuro monitoring, which is important during these procedures. So this is a glimpse of the brain and spine surgery and endovascular procedures which we are doing in our hospital. And we have got all the latest gadgets which are required. We have got all the latest technology. It's a teamwork which is doing the surgeries, and that is why we have been able to achieve more than 95% success in almost all the cases, even the complicated ones. We get a lot of domestic patients from all over the country in India, especially from the Delhi, UP, and adjacent states. We also get a lot of patients from Middle East, from African countries, a few patients from developed countries like even USA and Canada and Russia who are coming to this place for their surgeries. We get a lot of patients from Australia and Southeast Asia who are coming here because we provide the best treatment facilities, the good facilities for the attendants and patients at a very economical price. So we are not very expensive. To support us, we have got a lot of agencies who are supporting us. Especially, I thank the HCH group, who is bringing a lot of patients from the Northern African and Central African countries, whom we serve. We treat them; they are happy. So we have thousands of happy international patients who have been treated by us in last 10 to 12 years, and we have been following them regularly. They are coming regularly, sometimes with some other disease, sometimes with some other patient, sometimes just to thank us that we have made a change and we have improved the quality of their life. So thank you very much. I request you to give us a chance to serve you, and we will try to deliver you the best. Thank you very much. Namaskar.